is Michaela Landis, and my tics started in September. It all began when one day I started doing a shoulder twitch, and it wouldn't stop for a very long time. And then all of a sudden it changed, and I got a head twitch. And then that really got horrible because I kept jerking it, and it really embarrassed me because I was worried that people were going to tease me at school because some people started asking, and I just didn't want to answer them because I felt like they were going to tease me if I told them. So then for a very long time I had that. Then all of a sudden I developed a tic that sounded like this. I kept blowing air out of my nose, and then a little bit after that I developed a tic, and they became very loud, so I was embarrassed at home because I felt like so nervous that if I did it way too loud that somebody might hear me and think something bad's happening. And so then when I got bad, I decided to tell my friends that were very nice. So I told most of my friends at my table because I knew they wouldn't tease me. I knew they'd feel okay about it and know that it's okay. And sometimes it would get so bad that I would have to miss dance in school and other activities I did. And that's the story of my tics. These are some of the tics that I do. These are the ones that embarrass me the most. And then these are the ones that are okay with me. And
okay, do some tics for the camera. Okay, look at the camera. We are delivering this young lady's lower appliance today, and we will see her tomorrow for a checkup. This is what it looks like. Okay, and then we are putting it in right like that. We've already adjusted it. Go straight up and down. Okay, bite. And it opens her up about 5 or 6 millimeters interincisally. Okay. And she's going to wear it real good and then see us tomorrow and possibly the next day. Okay. This little girl has had her appliance approximately 17 or 18 hours now. And her tics diminish whenever the appliance is in and aligned properly. And when she moves her jaw to one side or the other, the tics come right back. These are the motor tics. The verbal tics are greatly decreased. Look in the camera and tell them how you feel. Right. Look in the camera and tell them how you feel. Yeah, Is it helping you?
It's helping me with my vocal tics, but it's not really helping me with my head tics.
Okay. But the vocal tics were very loud, right? Okay, good.
And sometimes I would do them, but it's definitely kind of mostly helping me.
Okay. Well, the motor tics will go away, the head tics, over time. Okay. This young lady returns after wearing her appliance for several months. As you can see, all of her violent head jerks and shoulder and neck jerks are gone, and they have been gone. Tell the audience, tell the viewing audience how you've been doing.
Well, the Sertators made my head tics go.
Slower and louder.
The Sertators made my head tics go away, and
you have no symptoms, right?
Mm-hmm.
Okay, that's good. Okay. It's been 10 to 12 weeks since we last saw this patient, and she has worn down the appliance considerably, and we have resurfaced the appliance. She had some slight, small vocal tics return only in the last 2 weeks, and as you can see, these are now eliminated. She's doing very, very well. There is no head shaking, skipping, hopping, and all these other things that you used to have, correct? Mm-hmm. Okay. Say something to the camera.
Well, the Sertators actually helped me a lot, and I feel better Well, I feel better about whenever I go to school because some people would say things, ask me about it, or say sort of, or once they said something mean about it, but now it's kind of gone away.
Okay. That's what grade are you in?
Fifth.
Fifth grade. That's a great improvement. We'll call in her mother and have her mother say something. How do you feel about your daughter's progress in movement?
Oh, it was a dramatic change from the time we came here. She was accumulating tics every week, and it started in September, and by the time we were seen in November, she had so many tics I probably couldn't even count them. They probably would have diagnosed her with Tourette's within a year, but now with the appliance, she rarely has tics, only when she gets really sick, and that's about it.
Yeah.
Really.
Who originally diagnosed her?
A doctor at Chapel Hill, I can't remember his name, and they told us we didn't need to come back unless it was so severe that it affected her life and her daily life, but we didn't want to put her on medication.
Was he a neurologist?
Mm-hmm.
Yeah.
Yes.
Okay.
And he did not diagnose her with Tourette's. He said he had to wait a year for that diagnosis,
Right.
and but there was nothing they could do. So.
Okay. There was nothing they can do, and they had no alternative but medications.
Right.
Okay.
And even they didn't want to do that unless it was to the point. But she's completely back to her old self.
Good. That's important.
Yes, it is.
Because otherwise everything would have progressed. She'd be much worse off today.
And hers was happening at such a rapid rate that, I mean, it was a major decline between September to November. And people now come up to me and ask, that saw her before, they don't even realize she still has it, the tic disorder. They say they never see it now. So.
Good. Well, that's an excellent report.
Lauren had severe tics about a year or so ago, and at this point in time, her appliance is at 7 millimeters height, which supports the jaw joints quite nicely. And as you can see, she's almost as calm as can be at this point. Mom does report if she goes to a department store and is inundated with various perfumes, it sets the tics off. So we have a little more work to do in trying to figure out what's getting the Tourette's kicking up and what might help her. We'll see how it goes. Thank you.